We're starting tonight at 10, though, with scientists sounding the alarm over a controversial announcement out of Washington tonight. Health and Human Services Secretary Robert F. Kennedy Jr. claims the federal government is going to discover and eliminate the cause of autism by September, but experts warn that's all based on discredited theories that actually do a lot more harm than good. Iowa's News Now investigative reporter Nick Elhaj is live in studio with an explanation tonight.
Mitch, Health Secretary Robert F. Kennedy says the plan involves hundreds of scientists and a sweeping investigation. But scientists and experts in the field tell me the plan stems from a fundamental misunderstanding of what autism is, and that all this just revives long-debunked ideas and undermines real science.
We've launched a massive testing and research effort that's going to involve hundreds of scientists from around the world. By September, we will know what has caused the autism epidemic.
Kennedy calls autism an epidemic, pledging to eliminate the cause for surging rates since he was a kid, something experts say is largely attributable to the ability to diagnose a hereditary condition, not some external source as RFK claims.
We'll be able to eliminate those exposures.
Kennedy is still pushing a widely discredited theory that attempts to link vaccines to autism. Now President Trump is backing those debunked ideas.
If you can come up with that answer where you stop taking something, you stop eating something, or maybe it's a shot, but something's causing it.
Science says otherwise. Decades of data reviewed by dozens of organizations and hundreds of studies show there's no link between vaccines and autism. But Kennedy's tapping David Geyer, a vaccine skeptic who's been delicensed and discredited, to lead efforts to defy the science. An approach UI geneticist and autism researcher Dr. Jacob Michaelson says ignores a key reality to neurodivergence.
Autism has a heritability of 84%, strongly genetic. And so that leaves very little room for other non-genetic explanations like vaccines. People have looked, we've looked again and again and again. There's no connection between vaccines and autism.
But there is reason behind the debunked theory's appeal.
It's rooted in emotion rather than reason. It's easy to draw because these things are kind of happening around the same time. It's like, oh my gosh, he was diagnosed at this age and he was also getting these vaccines at this age too. I think they might be connected somehow.
Scientists say the symptoms may emerge as children miss their milestones, but it's an increase in awareness and better screenings that's sparking more diagnoses, not a new epidemic.
For as long as there have been human beings on this planet, there have been autistic human beings.
Now, public health advocates worry the federal government's new focus spreads misinformation and will end up pulling funding from where it's really needed.
There's a lot of very good science that is going to be left undone because we've retreated. And it's important, I think, for the autistic community to take a stand on these things, that this research is in the process of delivering results back to the autistic community to help people thrive more. And we don't want to go backwards. We want to go forward with credible science.
It is important to note there's only 2 studies that ever linked vaccines to autism. Both were found to have been fraudulent and based on scientific misconduct and misrepresented data. I'll have a breakdown of all the data and sources I used for this story at iowasnewsnow.com. In studio, Nick Elhaj, Iowa's News Now.